It's a very mixed bag. If we look at 14 countries of the Pacific, you have countries like Cook Islands that are over 96-97% in terms of coverage rates. And then you have the Solomon Islands, which is, as far as we know, less than 1% coverage rates, except in a few pilot areas where it's over 20%. So really it's a very mixed situation. The focus of our support is on those countries that are doing not as well, so any countries that are sort of under 60% in terms of birth registration coverage rates. It's important for a number of reasons. It's often called a child's first right, and it's important because it establishes the connection with the family. So your identity and your lineage with your family, which is so important in the Pacific, where you have issues around land ownership and family rights to customary land. So it's important to establish that connection with your family and your lineage. It's also important as a child gets older to access services. So in some countries you need, for example in Vanuatu, to enroll in school, you need to be able to show your birth certificate. The same in Fiji. So in Fiji you always have a spike in birth registration as children are enrolled for the first time in school. In some places also access to healthcare is important. You have to be able to show an identity paper for that. So services that a child will need on an everyday basis. Then as you get older, of course, if you want to travel, if you want access to a passport, if you want to get a visa for another country, you often have to show proof of identity, which is a birth certificate, opening up a bank account, being able to access pensions. So throughout your life, a birth certificate is an important document to establish your legal identity. So for the individual it's important, for the family it's important, and also for the governments it's important, because the government needs to know how many children does it have and where are those children, so that they can plan for schools, for health facilities, for universities. So it's important on a number of different levels. So we've focused on supporting 3 countries, which is Kiribati, Vanuatu and Solomon Islands. And in those countries we're working with the civil registry offices and also Ministry of Health, because where we are working in that collaboration we see rates of birth registration increase a lot. So it helps when a child is born in a hospital if the registration service is available at that point. So what we do is we support training for civil registers, we support mapping and analysis of the system to identify where there's problem areas. For example, it may be a problem because the forms are not reaching the civil registration office, or it may be a problem for families because it's too far for them to go to the civil registration office. So we work with the partners to identify those problems and come up with some solutions to overcome them. And so for example, in the case of Vanuatu, they've decided that birth registration should be done at the hospital. So in 5 of the major hospitals throughout Vanuatu, as a baby is born, the parents can immediately apply for and get the birth certificate. So that's a major step forward. We're also working on awareness raising so that parents and caregivers understand the importance of birth registration, and in Solomon Islands, for example, working with the nurses who give out information when the mother comes in to deliver the baby. They give out information about birth registration. They encourage the parents to already think of a name so they don't have a delay in the registration process. And so all those things are helping to increase awareness and increase people's demand for the service. In all countries, the civil registration office has to be involved, and they have to give the formal documentation, the formal birth certificate, which is the symbol of the birth registration. So that is very similar in all the countries. However, it depends per country how decentralized the process can be. So for example, in Vanuatu, they can do it at the hospital level, but in Solomon Islands, everything has to be signed by the central civil register himself. So that's one person in the capital, Honiara. And so that's a major impediment, because all documents have to be sent to Honiara, get signed and be sent back. And you can imagine with the logistics of that in such a dispersed island nation that takes time and is a difficult process. In Kiribati, they've actually got civil registers on all the islands, and they work very closely with the island councils to provide the service as well. So they're able to reach a lot of a lot of people that way. The other thing that we're working on and supporting throughout the countries is electronic system of birth registration. So previously everything had to be noted down in a big book and sent to the Central Civil Registration Office. Now it can be done online, which is a much more secure and reliable way to keep data and information, and it means you can retrieve your birth certificate very, very quickly. So Kiribati and Vanuatu already have a central database, and it's already being used at the provincial level and in island councils. Solomon Islands are just about to launch, or just launching, their centralised database. At the moment it will just be in Honiara, but we hope in the future it will reach all the island groups. One of the big impediments is just reaching the service for families. That's why the decentralisation of the service to health facilities or island councils is so important. So convincing them that they should make the effort to go into the appropriate office and then to wait for the documentation to come back. Another reason is in many places alternative documents have often been accepted. So you can go and get a statutory declaration and that will be accepted by the authorities to prove identity. However, that is changing. And many places now are insisting, including banks, insisting on original documentation in the birth certificate. So I think we will see that more and more families are compelled to get birth registration because, essential services are demanding it. And then also one of the impediments has been the naming of a child. So for birth registration, families have the impression they have to give the specific name for the birth certificate, but in fact in many places that's not the case, and an alternative name can be used or the name can be changed later. But families are not aware of that, and often they have traditional naming ceremonies that have to take place sometime after the baby is born, and that can also delay them coming forward for birth registration. Well, yes, because of the dispersed communities, there may not be the services available. If you have a small population in an outer island, they're not going to have a civil register office in that place. And also for the documents to actually reach the central place, they have to go. Somebody has to take them by boat, they have to go by bus, then they have to be returned. So logistics is a big issue, and where it's possible, computerization, but in some communities electricity is a problem, and so computerization is not an option at this point. So maybe just to say that, in those circumstances where families, for example, have to go through a naming ceremony, part of the community awareness and outreach is to let them know they can still use an alternative name, or to encourage families to name the child and have a name when they come in for the delivery of the baby, one that's already been selected. And in terms of the logistic issues, I think it's trying to engage the health workers, and where we engage health workers, even if there isn't a civil registry officer available, the health workers are able to communicate the information, because hospitals usually keep very good records and they get translated into, up to the national level very easily.